Federal health officials are investigating a sharp increase in lung illnesses in the U.S. and whether it is tied to vaping. Officials from the Food and Drug Administration and Centers for Disease Control and Prevention are looking into 153 cases from the last 2 months. The illnesses are similar to inhalation injuries. Officials say it's not yet clear if there's a common cause for the illnesses. Many of the people who are sick have used some kind of vaping device, but no single product has been linked to all the cases. Dr. Janette Nesheiwat joins us now to talk about the potential dangers of vaping. Thank you for being here.
Yes,
First
my
of all,
pleasure.
it feels like this would be a no-brainer, but there are potential health risks. What are they for people?
Absolutely. So I'm having a lot of patients come in, Dana, with chest pain, shortness of breath, upper respiratory tract infections. They're coughing, they have fatigue. You can develop, bacterial infections in your lungs, but what we're seeing right now that's putting kids in hospitals, pneumothorax. That is a fancy word for your lungs. They're collapsed. And that is very dangerous. That's life-threatening because if we don't get your lungs inflated right away, you can go into cardiac arrest. And again, that can be life-threatening. So that's what we're seeing. That's what's putting these kids in the hospitals on ventilators in the ICU. Their lungs are collapsed or they're having severe difficulty with breathing, with getting oxygenation because of what they're inhaling.
You're talking about kids. Are we seeing the same impact on adults, or is this different?
So we're seeing it primarily right now in young kids, children who are vaping. And it makes sense. It does affect adults, but it makes sense because the lungs of children, they're not fully developed. They're not developed fully until about age 21.
Okay.
So their airway is very sensitive. And when they inhale these toxins and chemicals and carcinogens and these particles deep into their lungs, it's an irritant to their lungs. It causes inflammation in their lungs. It causes fluid buildup in their lungs, and they can't breathe. And that's why we're seeing more and more of them hospitalized.
With these health impacts, not just children, but adults also, are there other things that could be causing problems, not just vaping?
Oh, absolutely. Lots of things in young children could cause lung problems. If they have underlying asthma, cystic fibrosis, maybe they had already an infection, a pneumonia, the flu. So many things can cause lung disease. But what we're seeing here is a link between these children who are vaping and then they're ending up with respiratory distress, shortness of breath, and in the hospital. And the question is, what exactly is it that's going into their lungs that's causing this?
Do we know that yet?
So we have an idea. So some of these children, it's linked to marijuana, THC that they're inhaling. It could also be the artificial chemicals, the flavorings of the vape product that's causing an irritant. And when you heat it up along with the propylene glycol and other solvents and the nicotine, all together, it may be causing a reaction in their lungs that's causing them to be hospitalized.
Right. This was supposed to be a safer alternative for somebody who is a smoker, so that this was a better alternative to cigarette smoking. You're even the look you have on your face is it's not. Would that be accurate, or is it?
There is one good thing about vaping, and it can potentially, if used properly, help adults quit smoking. If you're using it properly, that's the key, because you can wean off the nicotine, and it can be safer if it's used properly, but it's the better of two evils. Nobody should be smoking or vaping, kids especially, because their lungs are so sensitive. And what we're seeing in these children, it can actually happen in adults as well.
Yeah.
But also with the kids, we're seeing them inhaling so much so quickly that they're having seizures because of nicotine toxicity. But the key is preventing this from happening by educating children at a very young age. It's harmful, it's dangerous, they can become lifelong nicotine addicts. And the study and the data shows, Dana, that about 50% of these teenagers, these young kids who vape, within 6 months will become regular cigarette smokers. And that
the
can
exact
lead to heart
opposite,
disease.
right? And the exact opposite of what the intent of these were when they came on the market.
Yeah.
You may not. I'm maybe throwing you under the bus here with this question,
Yeah.
but if the idea was to use this as a way to wean off cigarettes, the way somebody would use a nicotine patch, it doesn't seem to me, in watching the way people vape, that is how the majority of people are using it. Are people just using this as a substitute instead of trying to get off?
Some people are, and an adult has the right to put whatever they want in their bodies, but we got to keep it away from children. And again, it can be beneficial in smoking cessation if used properly, but we just have to, keep it out of the hands of the young ones.
And the message to children is?
Just say no. And also for parents to keep an eye out, any changes in behavior with your kids, because it can cause ADD, mood swings, behavioral behavioral changes, problems with thinking and judgment. So keep an eye out. If you notice any changes, talk to your child, talk to the teachers and their friends.
Are the companies, the vaping companies, embracing any kind of change now in seeing some of these problems?
That's a very
kids?
good question. They're claiming now to, stop marketing on Instagram and social media, because when you market, Tutti Frutti, cotton candy, fruit punch on social media, kids are going to see that, and
Right.
it's going to attract them. But they have stopped marketing. But I was very upset to see not long ago a vaping commercial on television. I think we should ban smoking, all smoking and vaping commercials, and maybe consider banning the chemicals that the artificial flavorings that kids are attracted to, and move that smoking vaping age up to 21. Smoking is 21. Why not change the vaping to
See
21?
if it can have any kind of impact. Dr. Janette Nesheiwat, thank you so much.
It's my pleasure. Thank you, Dana.